There are many different physical and alternative therapies in the management of arthritic patients. Patients that include dogs, cats, horses, and any other companion animal. The alternative techniques that we are going to discuss include acupuncture methods, therapeutic ultrasounds, neuromuscular electrostimulation, extracorporeal therapy, osteopathy, and thermal agents. The two forms of thermal agents include cryotherapy and thermotherapy. Cryotherapy is the application of cold to reduce pain and acute inflammation. This can be done with ice packs or cold cloths. This reduces nerve conduction of small caliber myelinated fibers and slows down blood flow through peripheral vasoconstriction. Thermotherapy is the application of heat by a warm washcloth or a heat pad and causes peripheral vasodilation. It arouses the number of thermosensitive receptors and escalates gait control mechanisms. It relaxes all paraarticular and musculotendinous structures. This form of alternative therapy for arthritic patients have been proven pretty effective when alternating between the cold and the heat. Therapeutic ultrasounds are another effective way to treat arthritic patients, such as dogs. Ultrasound machines, like the one shown in the bottom right-hand corner of the screen, are used for deep heating of the tissues. The vibrations from the ultrasound cause micro-massages that change membrane permeability, making it easier to get to the location of the arthritic region. This has been proven particularly beneficial when used with passive mobilization exercise and stretches after the procedure has been. Another form of an alternative therapy to use in arthritic patients include electrostimulation currents. It stimulates the tissue around arthritic parts and has been proven to be very effective in canines. There are two types. The first one is EMS, or electromyostimulation. This strengthens muscles and improves muscle trophicity. It also has been shown to reduce fatigue. The second electrostimulation current form is TENS, or transcutaneous electroneurostimulation. There are two forms of TENS, and it's gait control or endorphinic. Gait control is used for acute and superacute pain. It has been shown to cause rapid, short analgesia, which is a pain-free period of time. Endorphinic releases endorphins and encephalins. This has been known to cause a longer pain-free relief, or analgesia. The results from using force plate analysis showed that dogs that use TENS to the knees with chronic arthritic impairment had a significantly higher improvement in limb loading. Extracorporeal shockwave therapy is another method that can be used as an alternative technique to reduce pain for arthritic patients. It has been shown to have great success in canine therapy, and it also treats rheumato-orthopedic disorders in horses. It has been shown to reduce pain for up to several months, which is a long time for analgesia. The mobility and quality of life of dogs have been improved, even though there's no proof that any noteworthy improvement was seen on the radiographic images. On the bottom, there's an image of extracorporeal shockwave therapy being applied to a dog's leg. Some other alternatives that are included in the alternative therapies applied to arthritic patients are not directed at the painful joint or segment of the arthritic region, but prevention of repercussion on other areas of the body. Osteopathy and acupuncture are two of these other alternatives. Osteopathy focuses on the organs that the arthritis has not yet reached and restricts painful spasms and contractions that come from the arthritic region. Acupuncture releases endogenous opioids, which is a chemical compound in the body that acts as morphine. It has been proven to show long-term analgesia, and chronic and acute cases have been known to have great success with acupuncture. This image is to show what the points of interest are in an acupuncture for a dog who may have hip arthritis. The red points are the local acupoints, which are right around the hip area to show that that's the area we're focusing on to improve mobility in that arthritic region. In the blue are regional and distal acupoints, which are just a bit farther out than the red, except for down by the toes. And in the green are general action acupoints, which are just a farther out than the blue, and except for the toes, they're found on the legs, whereas the blue are found on the toes. So which is the best method for alternative therapies in patients? It all depends on several aspects, such as the type of arthritis, is it acute or chronic, and the location of the arthritic joint or segment all depends on if it's easier to apply an ice pack or do you need to get an ultrasound machine out to improve the mobility of the animal. It depends on the type of animals, such as dogs versus horses. Dogs are easier to bring in versus for horses you might have to go out and treat them, and you don't want to be lugging around big machinery. And extracorporeal shockwave therapy has been shown to have the best success. It has had longer analgesia periods for up to months, which is quite a substantial amount of time to have pain-free periods. And this method has also been proven to be very effective in canine therapy. So it's on the rise for canine therapy, and therefore probably spread to more companion animals and has the best success rates for alternative therapies for arthritic patients.